And to preventing a third wave, we have joining us Dr. Alara Roberts, a public health physician. She joins us via Zoom. Thank you for joining us on the program.
Thank you very much for having me. How are you?
Very well, thanks. Now, the Presidential Steering Committee warned that states of the Federation should heighten their, state of preparedness and continue to enforce all protocols put in place, given the renewed greater ease, or rather the spread of the Delta variant. Looking at the cases we've been recording, I know Lagos over 100, but in the other states and those cases, is it an early sign of perhaps increase or a sort of third wave, would you call it?
Very definitely, it is the beginning of a third wave. And what we want to prevent is we want to prevent a really high spike of cases. There's an uptick, and if we can level it out now and even get it down, that is the aim of the game. In Lagos State, we have always been the epicenter of this disease, and the last thing we need for our commercial activity's sake is a large number of cases that just take off in the community.
So looking at Taraba, which we just played, the Primary Healthcare Development Agency Executive Secretary saying that, NCDC's alarm isn't loud enough. There's still interstate movement across the country. There's also the threat of the highly transmissible Delta variant. Now, shouldn't we have red alert on all states of the Federation rather than those 6 and the FCT?
Well, thankfully, that's not a decision I have to take, and it is not advice I need to give anybody, because that's above my pay grade. But the bottom line is this. He did say something that was very critical and very crucial. Mask up, hand wash, space out. I keep saying that I'm not talking to government, because government has really done everything it needs to do based on the science that we have, based on the resources that we have. It is up to us as a people to obey, to just decide that we don't want to be victims of this really vicious, nasty disease, and we will just decide to do the right thing. Somebody had said it earlier in the week that the problem with this disease is that people do not really see its effects, because the people who get the disease and get sick are getting sick and dying alone. Family is not there to see how much they suffer. But what we do see, and what we keep warning people against, is that God forbid you have a loved one who gets really sick with this horrible disease and ends up in hospital. The family is running helter-skelter, looking for money, looking for oxygen, looking for this, that, and the other, and eventually the person goes and dies. That's a huge, devastating blow. It is at that time that the family suddenly realizes that, hey, this thing is real. And what I'm begging everybody, don't let it be your family. It doesn't have to be you. Accept that this is a nasty disease. It is real. It is running havoc in the country. And we have very simple, easy to obey solutions to prevent it wreaking havoc amongst you and your loved ones. Mask up, hand wash, space out.
Taking a look at some data, especially coming from the NCDC, I picked out about 10 states, Lagos, the FCT, Rivers, Oyo, Kano, Kaduna. Now, looking at some of the states on red alert, you'd see that for example, Lagos yesterday had on admission 2,285 cases. And as at today, so Monday into Tuesday, you have 2,417. So that has sort of doubled. The FCT had just one extra on admission. Rivers actually reduced, or you're reduced as well. States like Kano and Kaduna just have 3 to 4 cases on admission individually. But when we look at Akwa Ibom, which is not on the red list states, yesterday it had 54 cases that it is managing, and talking about Monday, and now as at Tuesday, and which we can see today, it's 110 cases. So essentially, the numbers there have doubled. What do you think could be happening, especially in Akwa Ibom, and seeing it's also not on the red list states?
It's very simple. Carelessness and complacency. People are no longer taking it seriously. People are going out, they're going to parties, large funeral gatherings, they're gathering together to watch football, they are crowding themselves into religious places of worship. You know, people are just being complacent and careless. And look at the numbers are going up. And whether you like it or not, one death is a disaster. One death is a disaster, because nobody suffers a loss of a loved one and starts saying, well, thank God it was only that loved one. Nobody does that. And this is a disease that we don't have any other protection. There's no magic bullet, there's no cure. All we have is prevention. And the major prevention that we have, the vaccination, we are still waiting for. So the next best thing we can do is to mask up, hand wash, and space out.
Indeed, the non-pharmaceutical interventions. We'd like to thank you. Always a pleasure having you on the program, Dr. Alera Roberts, public health physician.
Thank you for having me.